Hello, Wendy Amy. I'm a therapist in Hampshire in the UK. One of the things I like most about the ORS measure is actually it comes with the SRS measure, and sometimes I wonder if the SRS measure is the most valuable part of the tool. Getting a score of 40 out of 40 on SRS is pretty meaningless to me. It might mean that the patient thinks I'm so amazing that they can't give me any less, but I rarely get 40. In fact, I actually make it quite difficult for a patient to give me a score anything like 40 because I really beg them to be honest with me. You know, life isn't perfect. I know I'm not perfect. I know I can make mistakes. I know that maybe I'll interpret something in the wrong way, or I may not focus in quite the way that I would hope to focus. And so I value what I get back on the SRS. And a typical score might be under that band that causes concern. You know, frequently my score might be there, because when I give someone the SRS and I see them hovering over to the 40, I say, well, why would you be over there? You know, there was a point during the therapy when I felt that I really wasn't actually hearing you as well as I might, and I think you would agree with me. And they say, well, yes, but you know, maybe it's just the culture in the UK. People don't actually like telling you that they don't think you're much got. But I try to make it as easy as possible for people to say, hey, guess what? That wasn't actually as good or as helpful as I would like it to be. And what I learned from that is really just so powerful. And I wonder sometimes if it's not the SRS measure that's helping me to improve my outcomes in clinical practice, because my outcomes for some reason over the last 3 years appear to have improved. In fact, I went back over some client cases recently, back to just in the early days when I was using the outcome measures, and I was quite embarrassed when I actually saw some of the things that I was, some of the notes I made and some of the outcomes, and I thought, oh, for goodness sake, things do appear to have improved. I just love it when a patient has the confidence to mark me low. That to me says an awful lot about the Therapeutic Alliance, that they've got the confidence to say, hey, on this occasion I really felt there was something missing. You know, when I do an assessment session and somebody wants to score me quite highly, I say, but this is an assessment session. There must be something missing. There must be a lot missing from today's session. Are you really comfortable with the approach? Is there absolutely nothing at all that you would like to ask me about? You know, is everything exactly as you would like it to be? The conversations that I have with patients around the SRS are really so developmental. I learn so much about myself, and it's helped me to grow and develop as a therapist, and I'm really grateful for having that measure and for it being introduced to me 3 years ago. And I can't imagine where I would be today if I hadn't introduced outcome measures. So there you go. Bye.